Hey guys, how's everybody doing today? Today we're going to talk about stem cell therapy, PRP therapy, and how that heals your body. Go to the next slide. A little bit about Infinite Wellness. This is the company that I work for. We take a holistic approach to medicine. It's an integrated approach for physical medicine where we have chiropractic physicians on staff, medical providers, MDs, PAs, NPs, as well as therapists on staff. So we take a three-pronged approach to patient care, treating the body as one big unit every time patients come in. Next slide. So today we're going to talk a lot about stem cell therapy and kind of what that looks like. It's a hot topic, certainly, and I know there's a lot of questions about it. So the talking points that we're going to hit today are, first off, what are stem cells? How can they help heal the body and what that looks like? What conditions they can treat effectively? And what results do you expect to get from these and how timely those results may come? Next slide. So let's start with what are stem cells? Next slide. Stem cells are very simple, and the way I usually explain it is they're a baby cell that hasn't been told what it should be yet, and whatever it gets introduced next to, that's what it is able to become. So you have different types of cells within your body. Most of those cells are programmed to be something very specific, and then you have a select few cells, stem cells, that are unprogrammed and able to not only replicate themselves but become something that they get introduced next to. They're very intelligent cells. They have a very unique ability to mold and become something that it hasn't been told what to be yet. Next slide. So what are the different types of cells that they can transform into? And the answer is pretty much anything. So it could be cartilage, it could be muscle, bone, tissue, nerve, and as you think about ailments that you may have or people that you know that may have osteoarthritis or tears of some sort in the knee or the shoulder or what have you, these cells can come in and become those damaged tissue. Next slide. So what are you getting with stem cell therapy? And this slide is interesting. There's four main components that you're going to get when you get stem cell therapy. The scaffolding component is very important because that's the part that gives it structure and the part that gives it what it needs to become. The growth factors, which we'll talk a little bit more in depth when we talk a little bit about PRP, the growth factors are your body's natural response to go in and heal something, very similar to if you cut your skin and you have blood that is delivered to that area. You have oxygen, you have growth factors, it scabs, it scars, and then you don't have a big gaping hole in your skin for the rest of your life. So those growth factors are very important. MMP inhibitors, not to get into too much detail, they're matrix metalloproteinase inhibitors, and basically what a matrix metalloproteinase does is it breaks down the outside lining of protein, or the extracellular matrix of a protein. So what these inhibitors do is they block that capability so that it allows the stem cell to come in and become something without being broken down by your body. That's a very important factor. The last would be anti-inflammatory properties. And anti-inflammatories are important because most of the people that have these ailments have been told by some provider in the past that they should probably have a cortisone shot or a steroid shot. And a steroid shot is good for what it's asked to do, and that's decrease inflammation. It's a steroidal anti-inflammatory. So what we want to avoid is an inflammatory response when we give this so that your body is not trying to heal something or trying to come in and fix something with inflammatory markers that typically causes pain. Next slide. So the next question, or the next topic, is how can stem cells heal the body? Next slide. And that's what we touched on a little bit earlier. They become whatever's damaged or missing. So this is interesting because even with an avascular issue, like a meniscus tear, say, or cartilage defect in arthritis, You don't need blood to deliver oxygen to these areas to come in and try to heal something. What we're going to do is deliver a cell that has the capability of becoming what we put it next to, and we put it next to that meniscus or next to that cartilage defect, and allow it to properly become that and function the way that it should. Next slide. The analogy that I really like to give is patching a tire, and the reason for that is I have a slow leak in my tire right now, and I'm lazy, but it does make me think of the analogy here. And the analogy here is you have a slow leak in your tire. You're busy like me, and you don't decide to go get it fixed. You run to the gas station, put some air in it, and it's slow enough to where that your light doesn't pop back on to let you know you have a low tire for 3 weeks to a month, and you kind of forget about it. Then the light pops on about a month later, and you decide, oh, I need to go get this fixed, but I don't have time still, so I'm going to put more air in it. And this time you only get 2 weeks, and you realize, okay, it's leaking a little more than I thought it was. So that would be more along the lines of a steroid shot or a gel injection or a hyaluronic acid injection. Those are symptomatic treatments for arthritis or for knee pain or for shoulder pain, what you may have. The next analogy in this scenario would be putting a patch in the tire. The tire is fairly new. You don't need to replace it, but you do need to put a patch on it because it's leaking fast enough to where you're worried. So that patch is more along the lines of a growth factor or a PRP in this scenario, and what that does is it should get you to eventually needing to replace that tire. The last analogy would be the stem cell, and that's the tire's fairly bald, it's worn out, that leak is slow but it's significant and it's getting faster, and instead of patching it or putting air in it, you decide, all right, I should just bite the bullet and get a new tire. And that's what the stem cell does. It comes alongside and it becomes that new tire and gives it the tread and the bulk that it needs. Next slide. So platelet-rich plasma versus stem cell, and PRP, what I keep referring to is platelet-rich plasma. Platelet-rich plasma is derived from your own blood. We draw your blood, we do phlebotomy, we put it in a centrifuge, which spins it really fast and allows it to separate the different viscosities, very similar to oil and water. And those different viscosities, as they separate, there's a part that we want called the buffy coat. It's very rich in platelets, and those platelets have growth factors, and they're called platelet-derived growth factors. And by drawing those back off and not the parts of the blood that have the inflammatory response, we can introduce that to a knee or a shoulder or an ankle or a thumb or what have you, any joint really. And what that does is it allows it's a bolus of your body's natural response to heal something. When we look at stem cells, the difference here is that it doesn't need vascularity to necessarily heal something. We derive it from different locations. There's typically 3 locations that you can get stem cells, and we'll touch on that in a minute. But once we get the stem cells, we isolate the stem cells, we draw them up and inject them into whatever body part that needs it, and whatever it becomes, whatever it gets around is what it becomes. Next slide. So this is the big question: what conditions can help? Can stem cells help? Excuse me. Next slide. The answer is just about anything, to be quite honest. For our purposes, we're going to focus on a lot of the orthopedic issues. Osteoarthritis is big in our geriatric population, and unfortunately somewhat big in our non-geriatric population. Any tendon, muscle, cartilage damage, whether that be a rotator cuff, an ACL partially torn, an MCL, an ankle that's torn. You're looking at Achilles tendons. You can have golfer's elbow or tennis elbow, and if you have that, you know exactly what it is. Plantar fasciitis, one of my favorites because I'm an avid runner, and when I say one of my favorites, that's sarcastic because it's miserable. I've had it a couple of times. And carpal tunnel syndrome is one that we can use this for too. So just about anything any joint, any location that has an issue, there's typically an indication for stem cells. Next slide. So when we look at the locations that we're typically going to give this, the indications for an ankle or a knee, as you can see, a wrist, an elbow, fingers, toes, really, like I said, just about any joint, you're going to be able to put this in and allow it to do what it needs to do. Tennis elbow and golfer's elbow and plantar fasciitis are a little bit different. They're soft tissue injuries. It's where that tendon attaches to the bone. In all three of these scenarios, it does not feel very good, but at the same time, this will give you lasting results. And unfortunately, tennis elbow, golfer's elbow, and plantar fasciitis are typically treated with a steroid injection, and that typically does give the patient relief, but what we know about steroids is that it's degenerative to the tendon itself, and at most I would ever give is one steroid shot to any of those locations, but that is subject to whoever you ask. Next slide. So what are the results that people are experiencing and how quickly? Next slide. Most of the patients that I've given stem cells to have experienced some relief within the first week or two, and it always depends on what we're treating and how severe the injury or the degenerative process is that we are treating. Most patients within a month have significant results, and most of these last for years and years and years. It all depends on, again, what you do after the injection and what your body, how your body responds to the injection. So arthritis is one that we treat quite often because outside of a total knee replacement or a total shoulder replacement in our scenario, there's not a definitive treatment other than that outside of stem cells. Stem cells are the only treatment that would claim to regrow cartilage and increase that joint space within a knee or a shoulder to allow you not to have a total knee replacement or a total shoulder replacement. Next slide. So one of the things that I like to tell people is you have Kobe Bryant, Rafa Nadal, Tiger Woods, Dwight Howard, all big famous athletes that have infinite amount of money and anything at their disposal as far as any resource at their disposal as far as therapy. And they all have decided to use stem cells or PRP in some form or fashion to treat injuries and that they've had. This is not to say that you have to because someone famous did it, but it does say a lot that when they have anything at their fingertips and this is what they choose, it's significant. Next slide. So I just wanted to say thank you for logging in and listening. You can go to the next slide. We have 3 locations currently, Fort Mill, which you can see the address, Monroe, which you can see the address, and Rock Hill. And our Rock Hill location is where we're typically doing the stem cell injections. If you have further questions, please feel free to call the number you see, 803-547-4343. Thank you very much for your time.